the island of Jamaica, not Jamaica, New York. And 10 years into my practice, I started after a divorce. You know, divorces can change your life. And it did. So you decide that you're going to follow your passion no matter what. So I went into cosmetic surgery. Before I was an emergency room, pediatric emergency room physician. I loved it. I love saving babies' lives. And but it still was not my passion. My boss wanted me to specialize in that because I was good at it. Not being vain, I'm just saying that I was good at it. And I didn't. Came into cosmetic surgery, and this is what I love, and I've been doing ever since. When I started my journey, I wanted to embrace things that that's not possible, that it's a boys' club. We're not sure if we need a girl, you know. And I'm like, why? You know, being young, they're like, because it's a boys' club. And I was like, okay. And I called every single surgeon in my country because I wanted to do like an observership to learn more. I felt out of the pocket. I felt totally ignorant, didn't know what I was doing. So I wanted to do observerships, and they all said no. Today, I'm clearing up some of their patients' mess, but let's not talk about that, guys. Let's not talk about that I'm cleaning up their patients, but that's okay, and they're calling me now for advice. But let's not talk about that, let's move on. Because at the end of the day, karma is what it's about. I like to recognize 3 persons that he doesn't even know. I went to his clinic, it was a couple of days, and we've been friends since. The man changed my life, so thank you, Greg. Showed me, opened up his clinic, showed me everything, he held nothing back. I'm forever grateful. The other person who I owe a lot to, is Dr. Gregory Critchlow in Barbados, because he opened up his clinic to me many times, and I trained with him. And the third person who I owe a lot to is my husband, that very handsome, dapper man there. So I am chaos, he's organization. I'm chaos, he's organization. So we work very well. So he organizes my life, my clinic, my life and my clinic, my life and my clinic, and so we get along.
I find it kind of intimidating to stand here in front of you guys because, you know, the best liposuction surgeons in the world are here, and I feel like sort of, what can I tell you? But anyway, I'll try and make it interesting. So, this is the Empower Women Makeover. I would like to attempt to describe the zeitgeist, to talk about my thoughts behind the evolution of this technique over the last 25 years of practice. It's not my goal to promote a single approach, but rather to stimulate thoughts and ideas, and to try and explain an approach that has, in my hands, reliably, reproducibly good results and safe. This is the kind of surgeon I want to be. I want to show respect and humility by listening, but also trying to hear what my patients are saying, looking. So I think always I try and, in my mind, evaluate the risk-benefit ratio operating on anyone. And then I always also try and keep in mind the bonus mores of the area that I'm operating.
A big ass, and I need to get rid of the skin. Huh. How do you do that? Well, I'm going to kind of show how I kind of solve this problem. Let's see here. No financial conflicts. I use Vaser. I'm not a paid consultant. I think they paid me for one top years ago, but then I wasn't very good, so I'm not a consultant for it anymore. But I do love the product. I didn't pay for everything like you. So, just a couple of points about high def real quick.
We began using it only for keloid scars and hypertrophic scars. I learned a lot about this from Dr. Blugerman in Buenos Aires. He was using it a lot when I was training with him. And So we're not going to speak about any genetic factor or anything. Like there's a lot of genetic factors that give you potential keloid scars. But what
impetus for this was to actually expand then the selectivity of high definition. So as Dr. Hamlet taught me, you know, it was for the few and select. But with this procedure, we've been able to push the envelope. So guys with penises or heavier guys, you know, we'll see that today, can benefit from this procedure. So again, I wanted to bring what Dr. Haas said. Any of you who want to do high def must understand aesthetics of gender, just guidelines and the differences. And so Dr. Peter Schmidt's class in Boulder, Colorado is really critical for this. So I'm a member of the societies, and then my disclosures, I am a trainer for vasal liposuction and also for the Renuvion machine. So the traditional tummy tuck, right? It maximizes skin excision above the belly button.
Look who's here! Hey, hey, Dr. Lipo, say hi! Mejor, it's better late than never, right? Yeah.